Glutathione is an antioxidant produced in our cells. It's comprised largely of three amino acids: glutamine, glycine, and cysteine. Glutathione levels in the body may be reduced by a number of factors, like poor nutrition, environmental toxins, and stress. Its level also declines with age. In addition to being produced naturally by the body, glutathione can be given intravenously, topically, or as an inhalant. It's also available as an oral supplement in capsule and liquid form. At first glance, glutathione is similar to well-known antioxidants like vitamin C and vitamin E. But what's remarkable is that unlike most antioxidants, like resveratrol and quercetin, your body can make its own glutathione. It just needs the right building blocks. In fact, your body needs to make glutathione in order for you to live a healthy life. Scientists have even suggested that its levels are a great predictor of one's lifespan. Selenium is required by your body to make glutathione. This should be dosed at 200 micrograms per day, or by eating 3 Brazil nuts. A selenium deficiency can happen in many ways. For example, it's found to be low in people who are suffering from heavy metal poisoning, such as from mercury amalgam dental fillings. Glutathione reduces oxidative stress. Oxidative stress occurs when there's an imbalance between the production of free radicals and the body's ability to fight them off. Too high a level of oxidative stress can be a precursor to multiple diseases. These include diabetes, cancer, and rheumatoid arthritis. Glutathione helps to starve off the impact of oxidative stress, which may in turn reduce disease. An article cited in the Journal of Cancer Science and Therapy indicated that a glutathione deficiency leads to increased levels of oxidative stress, which might then lead to cancer. It also stated that elevated glutathione levels, raised antioxidant levels, and resistance to oxidative stress in the cancer cells. You can see my other videos on inflammation, on antioxidants, and on autoimmune diseases for more information on natural ways to reduce the damaging effects of oxidative stress. With less glutathione, free radicals can harm the body and accelerate the aging process, and increase cognitive decline. Multiple studies have uncovered that the body makes less of this antioxidant as we age. In women, its levels drop at the beginning of menopause and remains lower afterwards. Increased oxidative stress from low levels in older people can make the bones more fragile and contribute to osteoporosis. Cells that are depleted of glutathione are susceptible to damage. Low levels even trigger a cascade that ultimately leads to cell injury and death, which also accelerates aging. Mental health, anxiety, depression, and stress. Research has uncovered that people with depression have low levels of glutathione. Accordingly, glutathione prevented depression in animals who were under stress. What's more, anti-anxiety drugs may work in part by raising glutathione levels. Obsessive-compulsive disorder and schizophrenia. People with schizophrenia have low glutathione levels. N-acetylcysteine, which increases glutathione levels in the brain, improves symptoms of schizophrenia in clinical studies. People with obsessive-compulsive disorder may also have low glutathione levels in certain parts of their brain and high blood levels of free radicals. Boosting glutathione can improve the antioxidant defense, stress resilience, and overall symptom severity. Since multiple drugs used to treat bipolar disorder work by increasing glutathione levels, naturally boosting it may also help to stabilize mood and other related symptoms. A small study indicated that whey protein, when given orally, improves psoriasis with or without additional treatment. Whey protein had been previously demonstrated to increase glutathione levels. Study participants were given 20 grams as an oral supplement daily for 3 months. This is understandable as psoriasis is considered to be an autoimmune condition related to overinflammation due to a lack of sufficient antioxidants to neutralize the damaging free radicals. Cell death in the liver may be exacerbated by a deficiency in antioxidants, including glutathione. This can lead to fatty liver disease in both those who misuse alcohol and those who don't. Glutathione has been shown to improve protein, enzyme, and bilirubin levels in the blood of individuals with alcoholic and non-alcoholic chronic fatty liver disease. A study has reported that glutathione was most effective when given to people with fatty liver disease intravenously in high doses. Participants in the study also showed a reduction in melan dialdehyde, which is a marker of cell damage in the liver. Another small study found that orally administered glutathione had positive effects on people with non-alcoholic fatty liver disease following proactive lifestyle changes. In this study, glutathione was provided in supplement form in a dose of 300 milligrams per day for 4 months. Many swear on the ability of a liposomal glutathione spray to reduce a hangover and even increase alcohol tolerance. The reduction in glutathione with age may be a factor for hangovers also getting worse with age too. As people age, they produce less glutathione. Researchers at Baylor School of Medicine used a combination of animal and human studies to explore the role of glutathione in weight management and insulin resistance in older individuals. Study findings indicated that low glutathione levels were associated with less fat burning and higher rates of fat storing in the body. Older subjects had cysteine and glycine added to their diets to increase their glutathione levels, which spiked within 2 weeks, improving their insulin resistance and fat burning. Peripheral artery disease occurs when the peripheral arteries become clogged by plaque. It most commonly happens in the legs. One study reported that glutathione improves circulation, increasing the ability of the study participants to walk pain-free for longer distances. Participants who were receiving glutathione rather than a saline solution, placebo, were given an intravenous infusion 2 times daily for 5 days, and then analyzed for mobility. The enzyme serrapeptase has also been shown to be beneficial for this condition for other reasons. Parkinson's disease affects the central nervous system and is defined by symptoms such as tremors. It currently has no cure. One older study documented that intravenous glutathione had positive effects on symptoms such as tremors and rigidity. While more research is needed, this case report suggests that glutathione may help to reduce symptoms, improving quality of life in people with the disease. You can check out my video on Parkinson's disease for more information about other natural ways to help this condition. The chronic inflammation caused by autoimmune disease can increase oxidative stress. These diseases include rheumatoid arthritis, celiac disease, and lupus. According to one study, glutathione helps to reduce oxidative stress by either stimulating or reducing the body's immunological response. Autoimmune diseases attack the mitochondria in specific cells. Glutathione works to protect cell mitochondria by eliminating free radicals. Glutathione's antioxidant capacity can be increased when it's taken with vitamin C at a dose of at least 500 milligrams per day, and alpha-lipoic acid at 600 milligrams taken 2 to 3 times per day. Several studies, including a clinical trial reported in Medical Science Monitor, indicate that children with autism have higher levels of oxidative damage and lower levels of glutathione in their brain. This increased susceptibility to neurological damage in children with autism can be from substances such as mercury. You can check out my video on mercury amalgam dental fillings to learn about natural supplements to help detoxify this from your body. In the 8-week clinical trial on the children aged 3 to 13, a transdermal application of glutathione was given. The autistic symptom changes were not evaluated as part of the study, but the children in both groups showed improvement in cysteine, plasma sulfate, and whole blood glutathione levels. Long-term high blood sugar is associated with reduced amounts of glutathione. This can lead to oxidative stress and to tissue damage. A study found that dietary supplementation with cysteine and glycine boosted glutathione levels. It also lowered oxidative stress and damage in people with uncontrolled diabetes, despite high sugar levels. Study participants were placed on 0.81 millimoles per kg of cysteine and 1.3 millimoles per kg of glycine daily for 2 weeks. You can check out my videos on type 1 and type 2 diabetes for more natural solutions to help you control your blood sugar. Glutathione blocks the production of most inflammatory cytokines. If you suffer from chronic health issues, cytokines may keep you in a state of constant low-grade inflammation. A glutathione deficiency caused inflammation in mice. Blocking inflammatory pathways restored its levels. This suggests that glutathione and inflammation are in a very tight mutual relationship. On the other hand, glutathione blocks NF-κ, which is the master controller of inflammation in the body. This protein complex increases the activity of various inflammatory genes and their products. A number of airway and lung diseases are caused by excessive inflammation, and they also can benefit from restoring healthy glutathione levels. A low activity of glutathione peroxidase and low levels of glutathione are linked with high oxidative stress and an increased likelihood of heart attacks. Cardiovascular disease is largely caused by oxidative stress in heart tissues. Glutathione can reduce free radicals, and in turn it may prevent strokes and a heart attack. Various drugs of abuse, like cocaine and methamphetamines, as well as alcohol, increase the production of reactive oxygen species. These in turn can alter the brain and behavior or cause damage. Some studies suggest that increasing glutathione can help overcome addictive behaviors, which span from eating disorders to alcohol and drug abuse. Increasing antioxidant defense not only protects the brain, but it also helps to detoxify harmful substances from the body. Chronic alcohol abuse reduces glutathione in the liver. Raising the glutathione levels improved liver function during abstinence. Alcohol abuse also increases oxidative stress in the lungs, which can often lead to infections such as pneumonia. Glutathione may be able to protect the lungs by reducing the oxidative stress. Glaucoma and cataracts can gradually lead to blindness. Since oxidative stress underlies both, boosting glutathione may protect the eyes. Low glutathione levels may predispose pregnant women to depression and impair fetal brain development. Increased oxidative stress in the fetus has been linked to preterm labour. Boosting glutathione and antioxidants through sulfur and cysteine-rich foods may help to maintain a healthy pregnancy. People with cystic fibrosis have low glutathione levels and high oxidative stress. Low glutathione levels in the lungs impair breathing and trigger airway damage. Glutathione inhalation may improve the symptoms of cystic fibrosis. Oxidative stress in the kidneys can cause mild kidney problems or even full-blown kidney failure, depending on its severity. In a study of 20 people with chronic kidney disease on hemodialysis, glutathione improved kidney function and reversed anemia. In rats, the glutathione booster, N-acetylcysteine, prevented kidney disease from the artificial sweetener aspartame. People with irritable bowel disease have a decreased activity of the enzymes that are involved in glutathione synthesis. They also tend to have lower levels of its main ingredient, cysteine. The most important enzyme involved in quenching free radicals is called glutathione peroxidase. This enzyme uses glutathione, and it requires selenium to work with harmful substances. High levels of this enzyme point to more oxidative stress that needs to be neutralized. This enzyme also helps to renew and strengthen the gut lining. In animals, glutathione protected the gut lining, which may help to prevent leaky gut. N-acetylcysteine is a supplement that's used to treat conditions such as asthma and cystic fibrosis. As an inhalant, it helps to thin mucus and makes it less paste-like. It also reduces inflammation. N-acetylcysteine is a byproduct of glutathione. My video on asthma and my video on hypoxia have more information on natural ways to help you breathe. Glutathione is found in some foods, although cooking and pasteurization diminishes its levels significantly. Its highest concentrations are in raw and very rare meat, unpasteurized milk, and other unpasteurized dairy products, freshly picked fruit and vegetables like avocado and asparagus. Viral infections flood the body with oxidative stress due to inflammation, using up more glutathione. In many chronic diseases, poor immunity and an increased rate of infection are linked to low glutathione levels. Once glutathione is depleted, immune cells lose their ability to fight infections. N-acetylcysteine, which boosts glutathione in the body, restored the ability of immune cells to kill bacteria that cause tuberculosis. In another study, maintaining cysteine levels helped to keep glutathione in check. In turn, immune cells regained the power to destroy microbes. Older AIDS patients produce less glutathione, which weakens their already fragile immune systems, and it decreases insulin sensitivity. Increasing glutathione levels may help improve symptoms and reduce the incidence of bacterial infections. Reactive oxygen species are continuously generated while the brain burns fuel for energy. The brain needs to detoxify them to stay healthy, and glutathione plays a key role in making this possible. Alzheimer's disease is in part caused by oxidative stress. Antioxidants may prevent or slow the disease. Several clinical studies showed that oral vitamin E, which is a powerful antioxidant, slowed the progression of Alzheimer's disease. The buildup of toxic proteins in Alzheimer's further lowers the glutathione levels, making the patient more likely to be deficient. In mice with Alzheimer's, increasing glutathione can boost memory, reduce plaque buildup, and improve overall symptoms. Glutathione contains sulfur molecules, which may be why foods high in sulfur help to boost its natural production in the body. These include cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and pak choi. Alum vegetables like garlic, onions, and leeks. Eggs, nuts, legumes, lean protein like fish and chicken. The supplement D-L-methionine and MSM are also sulfurous supplements that can help with methylation here. Other foods and herbs that can help to naturally boost glutathione levels are milk thistle, flaxseed, guaso seaweed, and whey. Glutathione is negatively affected by insomnia. Getting enough rest on a regular basis can help to increase its levels. See my other video on herbs to help you sleep for more information on this. Glutathione is a powerful antioxidant that's made in the body's cells. Its levels decrease as a result of aging, stress, and toxin exposure. Boosting glutathione may provide many health benefits, including a reduction of oxidative stress. The most effective form appears to be the supplement S-acetylglutathione, where it was shown that 200 milligrams per day is equivalent to 1,000 milligrams of intravenous glutathione. Or to put it another way, a $40 bottle of S-acetylglutathione capsules is equivalent to around $4,000 of intravenous glutathione. Also be sure to take N-acetylcysteine at 500 milligrams 3 times per day, and selenium at 200 micrograms per day to supply your body with the necessary precursors to produce it. And take 500 milligrams of vitamin C and 600 milligrams 2 to 3 times per day of alpha-lipoic acid to also enhance its effect. Glutathione can be hard for some people with an MTHFR positive status. Therefore, check out my video on the MTHFR polymorphism and supplements that can help to treat this condition naturally.